Good morning and welcome back. Well, headaches come in all shapes and sizes, but nonetheless, they are a pain. And here this morning with some answers about, what causes headaches is Gunderson neurologist Dr. Clare Braun-Hashemi. Doctor, thanks for waking up with us this morning. First off, headache, kind of a broad term. What exactly, can you break it down a little bit for us?
In terms of the various things that might cause a headache, or exactly what it is?
What are some of the differences, the severities?
Oh, well, one of the more severe ones, and one of the ones that we see the most of, are migraine headaches. And those are typically hereditary headaches. The other kind of headaches, like the tension headaches, are common as well. But there's a whole host of different types of headaches. Some that are the most severe are the cluster headaches, trigeminal neuralgia. Cluster headaches, you get pain in the eye, tearing, nasal stuffiness. It's excruciating. It can wake you up in the middle of the night. The migraine headaches can also wake you up, but it's more of a throbbing associated with sound bothering you, light bothering you. It can be usually on one side of the head, but it can become bilateral. It's often affiliated with nausea, and then even vomiting can occur with that. There's triggers that can cause that. The other types of headaches are quite varied. There's way too many to mention here. But the key thing is to make sure that you know the ones that are serious and know what are the secondary headaches that you would need to go in and see, or actually go to the emergency room with.
Mm-hmm.
So,
and how serious is serious? How serious are we talking where it would require a trip to maybe the emergency room?
Well, if one that's extremely serious is a subarachnoid hemorrhage, where you'd have an abrupt onset of very intense headache. And that is, if it's the worst headache of your life, that's the one that you end up going to the emergency room for. And we always do a CAT scan in that case to make sure there's not an intracranial hemorrhage or something of that, something more serious. AV malformations, these are abnormal blood vessels, can also bleed and cause a headache. Strokes can cause headaches, so if they're associated with neurological symptoms, like weakness on one side of the body or the other, or problems with speech, those are all things that you would want to go to the emergency room with.
Real quick, because we're just out of time, prevention for headaches, these more severe ones, is there anything you can do?
Well, actually, the prevention ones are more like for the migraines or tension headaches. And migraine headaches, there are a number of medications that we use to abort them real quickly. We use the triptans to prevent them. If you're having more than 3 or 4 headache days a month, we often put you on medications. There's lifestyle changes that can help, making sure you get plenty of sleep, making sure that you drink plenty of fluids, don't withdraw from caffeine, don't overuse medications. Medications that stop headaches can actually cause headaches and actually cause them to become daily. So it's really important that you don't use medications more than twice a week. Caffeine either. Caffeine's another one that can trigger that if you go through withdrawal.
And as always, consult your physician if you have any more questions. And Dr. Braun-Hashemi, thanks so much for joining us this morning.
Sure.